I wanted to cover the topic of specific targeted blood-based nutrition. Now, these are smaller bite-sized pieces for specific concerns or conditions. The comprehensive is when we need to look at everything. But if you have a specific condition that's more in line with what you're looking at and you want to see specifically how it targets that area, we can get real focused. And the nice thing about those is they have a lower cost and they're only what you need. Now, all of these include a complete blood panel because we're still doing good medical investigation. But the extras around the outside are going to change a little bit, and the nutrients that we supply are targeted for those values. So it's a continuous system start to finish. So one of the ones that we do is immune-based blood work, where we have the complete blood panel, but we also have an ESR, or an eosinophil sedimentation rate, which tells us how much inflammation is in your blood and what it's doing to your blood cells. And a lot of times this is associated with immune problems. And along for that, we have a couple of nutrients that we know help with broad spectrum immune system function. One, we have the OHS OptiPara. Now, it helps with parasites, but that's all kinds of parasites. It's not just worms and bugs and gut problems, but it also looks at certain bacteria strains. It helps to supply your body with the nutrients necessary to fight off the bad bacteria and help good bacteria. That helps a lot of times, especially in the cases that I've seen with antibiotic resistant bacteria, where they try antibiotics several times and it doesn't get better. It helps with yeast. It helps with mold and fungus, and it helps to give your body the nutrients necessary to fight that off. Now, the other one that's in there is shrooms, because the essential shrooms have in them a lot of the components that your immune system uses to actually activate and perform the functions necessary to kill off whatever invasive problem is there. So those two together go really well. And then the third one that we have in there is resveratrol. Oh, sorry, we have two more. We have resveratrol and DAC, because resveratrol helps to bring down the overall storm of inflammation that goes along with having any kind of chronic infection. And it works really well to detoxify your body and help support your brain and your heart and your arteries. And there's about 1 billion things that it does. That's an average. And the other one is the DAK1K2. We know that every single cell in the body, including the immune cells, have a VDR and an RXR. That's a vitamin D receptor and a retinoic X receptor. So that's vitamin A and vitamin D that help to decrease your inflammation, increase your immune response, and make sure that it's not just an increase in immune response, that it's an appropriate immune response. So that helps with infection, chronic disease, as well as autoimmune-based inflammatory conditions. So that's what the immune blood work is all about. And again, we take that in a snapshot. The additional piece that we add to the blood is the ESR, which we have in there. And again, this is a small bite-sized piece. If you want to do the whole thing, you certainly can. One of the other ones that we do is for diabetes and obesity, because those two are parallel. The more likely outcome of diabetes is obesity, and vice versa. Obesity tends to lead to type 2 diabetes. They both cause and are caused by the same problems. So in the blood work, we have your complete blood count like we wouldn't have normally. But we're also going to include in there the A1C, which is a long-term measurement of how much sugar you've had in your diet, or how much blood sugar you've been dealing with. And sometimes it's not just dietary, it's just uncontrolled sugar. Then the other part that we're going to have in there is a glucose. So glucose we're going to add in because it helps us to determine how well your body's controlling your glucose right now. A lot of times, diabetes and obesity come parallel to stress. Having a chronically elevated stress level can negatively impact your glucose levels. So that's in there. Now, the nutrients that we're going to include for that, and this is something that if you know that you already have one of these conditions that you want to work on, if you've had recent blood work that shows this, and you're ready to get started with the nutrition, you can just start off with getting the nutrient pack. Now, in there is going to be a product called Fat Sugar Trim. It's an enzyme-based formula that helps to break down and digest and unclog the GLUT4 receptors on the surface of your cells. It helps to increase your sensitivity to the insulin you're already producing, if you're producing insulin. It also helps to reduce your leptin resistance. Leptin is a signaling hormone that is one of the major driving factors of hormonal obesity and type 2 diabetes. It's one of the things that switches your brain on or off for fat burning or hunger. It affects the center of satiety in your brain, and fat, sugar, shrimp will absolutely deal with that. We will also throw in one, digestion, because if you're eating and not digesting well, it causes a lot of inflammation, and that puts your body into a bad state for digestion, absorption, and really getting proper nutrition in. And it's a really critical component to this. It has a protect, because a lot of times, along with the inflammation of your obesity, and really obesity and diabetes have a lot of inflammation into it. Body fat, visceral fat specifically, is one of the only organs that forms after birth, and its only job is to pump out massive amounts of inflammation. You'll get cytokines and interleukins and so on and so forth, and these are inflammatory chemicals that go around and damage your body. The essential protect is in there to bring that down. The OptiGI, because if you're not digesting well, it can cause you to have blood sugar irregularities, and that causes inflammation in your gut. And the OptiGI really helps to balance out that gut environment so you can have healthy bacteria grow, and that's been shown to produce better chemistry in your body from your digestive system. Leaky gut is tied a lot to chronic inflammation and obesity and type 2 diabetes. And then there's also a methyl B. One of the common things that we see with people that have any kind of excess body fat is that they're tired. And they're tired from a cellular level of producing energy. It's the kind of tired that doesn't go away with rest. So in order to help with that, to give you a boost, to make sure that your body's producing enough energy so that you don't feel hungry all the time, so that you can help to overcome your cravings, we put the methyl B in there, and that's the kind of B vitamin that your body can use right away. It's not a synthetic vitamin like you'll see in energy drinks that'll actually cause brain damage. This is a really good whole food based, as all the products are from OHS, vitamin B that will help to affect your brain and reduce your stress and your mood. And that's why I picked that specific group of nutrients, is because we kind of have to target it from a couple of different angles to give you the maximum benefit so that you can see the outcomes you're looking for. We do have an entire online weight loss group specifically for this problem, and a lot of our members there use this test as a marker of where they're going, in case they want to see multiple areas rather than just, does the scale move, or do my clothes fit better, or how do I look? We like to take a blood-based metric because sometimes your body has a lot of cleanup to do before you start to burn off body fat. So that being said, that's a really good package. The next one we have is heart-based blood work. Now, if you have family history of heart disease, if heart attacks run in your family, or if you see some of the clinical signs, like interesting from Chinese medicine, you'll see a line in your ear here that strongly positively correlates with heart problems. A lot of times if you have swelling in your ankles and your lower legs, or difficulty breathing, or difficulty with breathing upon exertion, those are some clues that maybe you have some heart issues. And maybe you have a known heart issue and you just want to take a checkpoint to see where you're at. That's where we use this particular test. Now, we have the CBC. Again, we're doing good doctoring work. We have a C-reactive protein, which tells us if there's any damage to your heart muscle. This is also one of those that we do for anybody that has chronic lethargy or a lot of energy production issues, if they get really tired really easy. So this is good to check for damage to the heart muscle. The other one that we have in there is the Omega Check. So the Omega Check is something that I learned about a long time ago, and basically what it says is we eat too many things that are omega-6 containing, and our omega-3 and omega-6 balances off. Omega-6 foods are pro-inflammatory. It's anything with corn or soy, and that includes animal products. So they feed chicken corn, they feed cows soy, and they feed all of that to fish. So if you have farm-raised animals that are not grass-fed and pastured, then there's a high likelihood that you're going to have a lot of corn and soy in your diet. Or if you just eat a lot of corn and soy, that pushes the omega-6 up. That causes a lot of inflammation. Omega-3 is is anti-inflammatory, and it's very rare to find that naturally. There's a few sources of it that you can find. The trouble is things like flaxseed are poorly converted in the body. You only get about 10% conversion. So that leaves us looking for supplementation. And the long and the short of it is, if you have an omega-3 to 6 ratio that is more than 1 to 4, you will have chronic inflammatory problems no matter what else you do, because that is a key essential element to how you process those fatty acids that are essential and what happens because of that. So that's one of the things I like to touch on. Now, how do we correct that? Obviously, if you have an imbalance, we're going to give you essential fatty acid. That's fantastic. It's a great thing for your heart. It's good for your brain and arteries and every other part of your body. It takes that inflammatory stress off. Now, there is a product that OHS has that's only available in the custom packs. It's called Creanitric, and it's creatine and nitric oxide. And what that does is that really helps with vasodilation. It helps to reduce your blood pressure and to get your circulation to the tissues that it needs to get to, and that reduces overall stress in your system. There's resveratrol. If you want to know more about resveratrol, I strongly suggest that you look it up, that you look on the OHS website. Now, I will tell you, most resveratrol is not bioavailable, and it is not bioactive because it comes from discarded grape skins from the wine industry, and by the time they get in the bottle, they're not really bioactive. There was a huge study done on that. They looked at over 450 different types of resveratrol, and it's not as potent as you would like. And if you think you're going to get it from your red wine, you'd have to drink about 10 gallons a day, which has its own problems. I don't recommend it. So resveratrol from OHS, highly absorbable, high impact, great bioavailability, pre-digested, gets right into the system and gets right to work. That is one of those that I do recommend you start off slow because it can make a big change in your body. And if I've had people where they try to take too many at once and it causes some issues. Now, Opti Heart. This is formulated specifically for everything related to heart. So if it doesn't matter if it's post-heart attack or congestive heart failure or any of those other things. This helps with heart and arteries and blood vessels and circulation. There's a lot of benefit to that one, and I'm not going to unpack it because there's a bunch of ingredients, but I'm not going to get into the OptiHeart too deep because I could sit and talk about OptiHeart for probably a whole day. But again, that's a great formula that has proven benefits. The OptiAcute. The OptiAcute has been shown in laboratory testing to make it so that your blood does not stick together. Now, the main purpose of your blood is to circulate oxygen nutrients to your cells. We know that. And when your blood cells all stick together, that's called a rouleau formation or a stack of coins, because that's what it looks like. Now, you can imagine if you had a bunch of those all stuck together, like a stack of coins or donuts, that the surface of that is blocked by the one directly next to it. So you're really not getting a good surface area. You're not getting a really good delivery of oxygen to your cells. And this helps to reduce that. Also, the number one thing that causes heart attacks is when you can't get enough oxygen and your heart has to struggle to pump more than it should. So the acute is in there, and that helps with all kinds of chronic pain, all kinds of acute pain, all kinds of inflammatory problems. And the last one, of course, is protect, because that one has a really powerful effect of bringing your inflammation down to then keep your heart from receiving damage. And if you can see, the test, the trouble, and the resolution all go together as one nice, neat package of stuff. Another package that we have is the allergy pack. Now, allergies can be allergy, they can be autoimmunity, they can just be chronic sensitivities or multiple chemical sensitivities. So it might not be what most people think of as like a food allergy where you eat it and everything puffs up and you swell and you have a hard time with things. It can be low grade chronic inflammatory, things ache, they hurt, runny nose a lot of times, chronic sinusitis is allergies, everything that can happen from your eyes all the way through from the mouth to the south, everything is included with that inflammatory process. And we have a way to check. We're going to run the CBC with the differential like we do for all of these, which is really nice test to have just for a general baseline. And that's easy. You can take that to your medical doctor and show them, say, hey, look, I got this blood work. I'm going to use this nutrition and fix it. Please monitor me on this. I want to make sure that everything's on the up and up, and it will be. So then we also have your C-reactive protein, which tells us basically your chemical level of inflammation. Now, we know that if you have enough inflammation, you will have an allergy. Your body's immune system is used in a variety of different ways. If you don't digest well, your immune system shows up. If you have chronic stress, your immune system shows up. If you have physical damage, your immune system shows up. If you get an infection, your immune system shows up. So if your immune system is taxed, you're going to be inflamed. Now, the way that we deal with that is with the allergy pack. And OHS has already done a fantastic job of putting that together. That's available there on their website. And it helps to address all the factors of immune that we just mentioned, so that you can have your body in balance and get better. Next thing I want to talk about specifically is vitamin D. Out of all of the different vitamins, technically it's a hormone, but we'll just say vitamins, vitamin D has the greatest impact on every part of your body. So if you're not taking enough vitamin D, or in a lot of the cases that I see, people are taking a lot of vitamin C. We're talking 15 to 20,000 IUs a day, and yet their vitamin D is still very low. 10, 15, 20, even 30 is still pretty low. It should be somewhere around 90 for good health. There was a study done that looked at the global population, 4 million people, and they basically said that if you have a vitamin D of over 50, statistically, you're not likely to die, which is to say that if people's health fails, they won't be processing vitamin D correctly, and it puts them at a disadvantage. Most every person that I've worked on that's had chronic illness of any type has had vitamin D issues. And sometimes that's the body being burdened, sometimes it's a lack of supply, sometimes that's bad digestion. But this test tells us what's going on in your blood. And it allows us to see how much vitamin D you actually need on a day-to-day basis. Inevitably, if people live in sunny climates, we hear that they're outside having a good time, or it's sunny out, so they don't need to take vitamin D, but maybe they're not outside enough. And rather than guess, which doesn't usually go well, I say we can test. It's a relatively inexpensive test, and you get a bottle of vitamin D along with it. So that's something that we can do for you. Now, one of the questions that I'm sure is on your mind is, what happens if my blood is beautiful? What happens if it's perfect and I don't need the correction that you guys offer? Well, for that, if your blood is perfect, or you've done it a few times and it's better and that condition is resolved, then what we have is called the Every Patient Every Day pack. These are essentials that we know are not commonly available in food. Out of all the tests we run, all the data we gather, all of the results that we see, we know there are certain common threads that are common to just being human and living in our modern environment. So we can provide for you, which is basically our multivitamin that covers not just vitamins, not just minerals, but also phytonutrients that are the higher level, more complex chemistry that you find in plants that work really, really well in your body to keep you healthy. So if everything comes back and it looks sparkling, perfect, beautiful, and you just want to keep it that way, the Every Patient Every Day pack is a great place to start. We've had plenty of people that say, I'm not sure where to start. I'll just start with that. And then in 3 months, if I don't feel any better, or if I feel only marginally better, if there's still anything for me to work on, then we can take a look. And that's perfectly fine. Everybody starts this program the way that they're comfortable. And we want to make sure that you have plenty of options. And if all of the things that we described here, if none of them really match or they don't really resonate with you, then you can always reach out and I can personally give you directive and guidance on how to get started. So with that being said, of all the packs that we've listed, if you want to start with any of them, click on the link below. It'll take you to the website and you can get started there. We look forward to being your healthcare provider. Thank you very much.